السلام عليكم. أنا المواطن خليفة محمد بالقاسم من ليبيا. أجريت عدة عمليات في تونس، وأجريت حتى في المستشفى هذا سابقا في 2015 عملية نفس الدكتور، وكانت العملية كويسة يعني ممتازة، وهذا السبب اللي خلاني رجعت السنة هذه للرجل اليمين. الدكتور أحمد يكين هو اللي أجرى لي العملية الأولى والثانية، ونشكره يعني شكر جزيل يعني. والمستشفى كل خدماتهم ما شاء الله، والحمد لله العملية نجحت بتمام نجاح الحمد لله، وأنا ممنون يعني من خدمات المستشفى. وندعو كل واحد مريض يجي يدير عملية عند المستشفى هذا، لأن الحقيقة خدماتهم ممتازة وصادقين في أعمالهم يعني. ونشكر الدكتور أحمد يكين ونبلغ السلام لهم.
Hello, I wish everyone healthy days. I am Professor Dr. Ahmet Hiken. Our patient Khalifa is from Libya. He came to us 3 or 4 months ago with his scans and test results. At that time, during our evaluations, we learned that the patient was diabetic, had undergone 4 operations on his right knee, and had been experiencing serious problems with this knee for a long time. Later, we invited the patient to our hospital and performed the necessary radiological and clinical assessments here. When we saw that the patient's CRP and sedimentation levels had returned to normal and had stayed that way for a long time, we understood that the infection was under control. However, in the X-rays taken, we observed that an antibiotic cement had been applied in place of the previously inserted and removed prosthesis in the knee joint. The patient had no discharge. However, the knee was, of course, immobile and appeared quite swollen. Therefore, MRI and CT scans were performed to provide the necessary details for explaining the surgery we would perform on the patient. As a result of these examinations, we explained that it was necessary to remove the existing cement fixation in the patient, and that after thoroughly debriding this area, we planned to perform arthrodesis using human-derived allografts in this region. However, in order for this arthrodesis, that is, the process of immobilizing the joint, to be successful, we needed to secure the area with certain materials. For this purpose, we planned to use thick and highly durable plates. After the necessary preparations were made for the patient, the existing cement was removed and the area was debrided very carefully and in a controlled manner. After the necessary cleaning procedures were performed on both the bone tissue and the surrounding soft tissue, it was observed that this area was vital, well vascularized and healthy, and therefore it was decided to apply bone grafts here. And after this procedure was carried out, the knee joint was fixed with a plate, the surrounding area was completely filled with allograft bone grafts, and the skin was closed. After a long follow-up period, despite some very mild leakage during the first week, the patient had no problems. We did not experience any systemic problems. The diabetes was under control. And during the last week of my examinations, it was noted that there was no discharge, no bleeding, and the patient was informed that it was possible for them to walk using a walker. After a very short rehabilitation period, the patient started walking with a walker and even with Canadian crutches. From now on, our patient will not be able to move their knee, but they will not have any pain or discharge and will be able to walk independently and comfortably. Have a good day.